Bleeding and clotting. Introduction. Bleeding and clotting can be influenced by different conditions and drugs and must be managed when undergoing certain dental procedures. Blood clotting. Hemostasis is a process of the stopping bleeding, otherwise known as blooding clotting. There are 4 phases of hemostasis: vascular, affected vessels, vasoconstrict, platelet primary, platelet block forms, coagulation secondary. Vascular platelet coagulation, fibrinolytic, fibrin clot form that holds platelet block together. Plasmin enzyme dissolves fibrin clot after blood vessels and healed. Platelet pathway adhesion damage to endothelial walls causes release of von Willebrand factor on vessel wall, which attaches to platelets via glycoprotein 1b. Activation by a von Willebrand factor activates platelets to grow extensions and secrete thrombosan through A2 and adenosine diphosphate, which activates even more platelets. Positive feedback. Aggregation. Activated platelets express GP11B, which attaches to fibrinogen in the bloodstream. Fibrinogen causes platelets to stick to each other. Platelets attaching to each other activates coagulation factors: fibrinogen, fibrin, prothrombin, thrombin, tissue factors, calcium labile factor, stable factor, antihemophilic factor, Christmas factor, Stewart power, pro factor, plasma thromboplastin, antioxidant Henchman factor, fibrin stabilizing factor. Most coagulation factors are synthesized in the liver. Coagulation cascade. Location of coagulation cascade activated where the large block of the platelets are covered by fibrinogen. There are 2 different pathways, intrinsic and extrinsic, that covers on the common pathway. Extrinsic pathway factor 3 activate factor 7, activate factor 10, intrinsic pathway factor 12 activated by trauma or exposed collagen, activated factor 11 factor activate factor 8, 9 activate factor 10. Factor 11 can be activated by factor 2 to skip factor 12 activation step if there is no exposed collagen. Common pathway factor 10, factor 5 activate factor 2, activate factor 1, factor 13 activate factor 2, activators 5, 7, 8, 11, 13. Positive feedback. Bleeding disorder. Clotting factor defect, hemophilia A, factor A deficiency. Most common have hemophilia, autosomal, X-linked, recessive. 80% hematoma, risk with iron block without prior factor A infusion. Should use local injection in the mandible instead. Hemophilia B, factor A deficiency, hemo C, factor 11 deficiency, vitamin K deficiency, required for synthesis of factor 2, 11, 7, 9, 10, most common acquired factor deficiency. These factors are made in liver. Von Willebrand disease. Von Willebrand deficiency, liver disease, impact factor affected in with K deficiency. INBDE protein factors deficient in hemophilia are all within the intrinsic pathway. Vascular wall defects, rare to have bleeding episodes during tooth extraction, impact first phase of hemostasis. Marfan syndrome, hereditary, Ehlers-Danlos syndrome, hereditary, Osler-Weber-Drendu syndrome, dental management, minimally invasive dentistry, consult with hematologist, avoid NSAIDs, use local hemostatic measures. Platelet disorders, thrombocytopenia, low platelet count, can be drug of disease induced, normal 150,000 platelet, valvular brain disease, valvular brain disease deficiency, most common congenital bleeding disorder 1% of population, oral manifestation, gingival bleeding, spontaneous, petechia, and ecchymosis, hematosis of TMZ. Diagnosis and treatment. Platelet testing. The following tests are used to help diagnose platelet disorder or if antiplatelet medications are working. Assess platelet quantity, platelet count in blood sample. IV bleeding test, measure time, stop bleeding after making a cut in the arm, unreliable. Assess platelet quality. IV bleeding test measures time to stop bleeding after making a cut in the arm, unreliable. Peripheral blood smear, morphology of blood cells using the microscope. Platelet aggregation test, assess platelet aggregation to form blood clot. Platelet function analyzer, measure platelet coagulation under flow condition, not used for mild bleeding disorder. Coagulation testing, activated partial thromboplastin tear. APPT measures second need for clot to form after addition of reagent to blood sample. Number 25, 35 seconds. Test intrinsic and common pathway. Best test for coagulation disorder. Prothrombin time. A measured seconds needed for clot to form after addition. A reagent blood sample normal 11 to 15 seconds. Most used with patients on warfarin. Produce an international normalized ratio INR, smaller INR clotter, larger INR bladder. Antiplatelet medication, aspirin COX-1 inhibitor, prevent TXA2 synthesis, irreversible. If ibuprofen COX-1 inhibitor, prevent TXA2 synthesis, reversible. Abscizumab band to ZP11B 3A complex block activation. Clopidogrel, competitive inhibitor or ADP blocks activation. Anticoagulant, abisabine factor 10A inhibitor. Dabigatran binds to thrombin factor 2A. Heparin brings together thrombin and antithrombin, blocks factor 2. Warfarin block with K reduction cycling, block factor 2, 11, 9, 10. Dental management. Patient on warfarin avoid the following: NSAID and aspirins, barbiturates, steroids, metronidazole, erythromycin. Or herbal supplement, local hemostatic precautions, extraceuterine, topical thrombin, compressive packing, tranexamic acid mouthwash 4.8%, use acetaminophen for pain. INR 2 and 3, carry on with treatment. INR 3, 35